All right, so we're still talking about some aspects of resuscitation. That's trying to actually get oxygen to the patient. All right. So for this one is what is known as what intubation. We'll talk about intubation. Then we'll talk about cricothyrotomy. Okay. Intubation and cricothyrotomy. So, of course, it's kind of like we're supposed to say cricothyrotomy and intubation because you actually have to do the surgery. Okay, you incise through the cricothyroid muscles before you intubate. So first of all, they are both airway management techniques. You understand? They can be done differently, or you do them together. So for intubation, done alone, you just have to do it. You are trying to insert a tube like right into the trachea. This is because you want to maintain an open airway so that the patient can keep breathing. All right. So types, we have the endotracheal intubation. This one is through the mouth. Then we have the nasopharyngeal intubation. This is through the nose. Okay. Also, when you do the cricothyrotomy surgery, you can also do an intubation right there. So procedure is performed using a laryngoscope to visualize the vocal cords. A balloon curve is inflated to secure the tube. Now the tube is connected to a ventilator or a bag valve max. So indications, like when will you want to do an intubation? If the person is having a lot of issues with breathing, airway obstructions, surgery under anesthesia, cardiac arrest or unconsciousness. Okay, so this is surgery. All right. Then cricothyrotomy, this one you create an airway through the cricothyroid membranes. Do you understand? This is when intubation fails. That's like intubation through the mouth, it has failed. You understand? So types are the surgical one, which is incision and insertion of a large bore tube. Needle one, this one a catheter is inserted for temporal oxygenation. So indications, you basically go in for this surgery, this cricothyrotomy. This is mostly when you have tried to intubate the patient right through the mouth or nose, but it has failed. The severe airway obstruction. Okay, so you just have to do it insiding through the cricothyroid membranes, making a vertical skin incision, then a horizontal cut through the membranes. Then you insert, then secure the airway tube.